Hello, my name is Ashley Ettinger, and I am the Senior Director of Strategic Supports for the Rocky Mountain Partnership. You are tuning in to our on-demand workshop focused on opioid key driver development. Before we dive into key driver development, we'll do a quick overview of the Rocky Mountain Partnership and the Adams County Opioid Abatement Grant. And throughout our time together, we'll support you to understand how to map your proposed project in a way that illustrates the outcomes you would intend to impact, and of course, the metrics and key performance indicators that you could track to measure your progress and impact in real time. This is what we refer to as our key driver tool. In addition, we'll support you to develop your key driver for the Opioid Abatement Grant application. This includes the opioid-related outcomes you would intend to impact through your project and what an additional goal towards these could look like, the factors and barriers contributing to the opioid crisis that your project would work to address, the initial strategies you would be working to deploy through your projects, and, of course, as mentioned before, the key performance indicators that you would track to measure your progress in real time and related goals. Now, before we dive in, I do want to do a quick overview of the Rocky Mountain Partnership and the Adams County Opioid Abatement Grant so you can get some of those big high-level questions you might have out of the way. So who is the Rocky Mountain Partnership? Well, the Rocky Mountain Partnership is a network of community members and stakeholders from public and private sectors who are working together to solve challenges that stand in the way of economic and social mobility. We primarily are focused in the North Metro area, which includes Adams County, the city and county of Broomfield, the city of Arvada, and the city of Aurora. Together, these stakeholders and community members work together on collective projects that build on what works rather than recreating the wheel, testing and scaling innovative solutions, breaking down silos, improving coordination, and removing obstacles, and supporting dollars to go to what works, and supporting policy changes that align with effective solutions. Our role in the opioid work is primarily focused on that bullet, focused on dollars, but there are a lot of other roles and places that the Rocky Mountain Partnership engages in. Now, we're all running towards a shared vision, a North Star, if you will. Our North Star is that we have an inclusive and prosperous region where every community member, regardless of race, ethnicity, gender, age, zip code, or circumstance, has the opportunity to earn an income that allows them to take care of themselves and their families and thrive from cradle to career. Towards this, we really have three main areas that we do collective work in. The first is focused on growing our talent to ensure that every individual can prosper. The second is focused on increasing income-aligned housing to ensure that every individual can live where they work and learn. And the third area, which we'll dive into today in the concept of this key driver development, is combating the opioid crisis to ensure every individual can survive and thrive. Now, these areas are super interconnected, and you probably, as a practitioner who operates in this space, know that all too well. And so while today's workshop is focused on developing a key driver for a project focused on combating the opioid crisis, it might also touch on some of these other work areas as well. Now, I do want to do a quick review of the Adams County Opioid Abatement Grant. As you may or may not know, there are millions of dollars coming into the state from national opioid litigation settlements with big pharmaceutical companies and manufacturers and other folks. And the Colorado Attorney General Office has put together a strategy and a joint framework for how to divvy up those funds. In fact, they decided to divide these dollars into different regions. Adams County is Region 8 of all of those regions. The Rocky Mountain Partnership facilitates the Adams County Opioid Abatement Council, which you may or may not be familiar with. If you're not familiar with the council, this is the body who is charged in identifying where these county and regional opioid litigation settlement dollars should go. The council went through a process of identifying where there are gaps in needs and services and opened an initial round of grant dollars, opioid litigation settlement dollars, through an RFP process in the end of 2022. It was their intent and continues to be their intent that these dollars are being used to improve outcomes related to the opioid crisis for community members in Adams County. To identify where these dollars should go, they looked at data, community insights, and other information through our interactive data dashboard to not only understand what's currently happening in the region related to the opioid crisis, how the community is being impacted at all levels, but also that's the space where they're working to track the progress and impact of regional work underway to address it. And that includes the distribution and impact of these dollars. With grantees from that cycle now actionizing their projects, the council has opened up the second cycle of the grant, which closes on November 3rd. And if you're tuning in, you're likely someone who's thinking about or considering applying for that grant. And this workshop will help you with one key piece of that application to really help set your project up for success. Now, before we hop into the next piece here, I do want to just do a little bit of a tutorial where you can find our data hub. The Opioid Data Hub is one of several data and information tools that the Rocky Mountain Partnership has made publicly available for use by partners, the public, community members to help inform and drive decision-making. On our website, which is rmpartnership.org, you can visit our data hub, which has links to each of our data tools. I'm going to open two just so you can find where they are. The first is the Rocky Mountain Partnership Scorecard. The scorecard is kind of our overarching data infrastructure that helps us track around 33 indicators or so that help us understand what is happening around economic and social mobility in this region. And also whether or not we're closing gaps for our populations who are most impacted. It looks like this, and you can navigate a variety of different metrics from across these areas: basic needs, health and mental health, social and criminal justice, education and training, economics and workforce. Again, this is an available tool that, if it's helpful for you, it's publicly available on our website. It has data from across the geographic scope that comprises the RMP region. As I mentioned as well, our Opioid Abatement Council actually utilized a specific opioid abatement data hub that we built to help really drive where these dollars should be going. The way that it's structured is you can check out not only data and voice and perspective, but information about policies, funding, services, and programs that already exist, what's impacting. And then the last tab will be comprised of key performance indicators. We're in the process of getting the first round of data and putting those live, but you'll actually be able to see and track in real time what the measurement and impact of these litigation settlement dollars have been. So stay tuned. This is in the process being built out. You can see the initial round of cycle one fundies here, and then some of the metrics that they're tracking or planning to track. So that will be live soon, towards the end of October, early November. Revisit that back at a later date. All right. Now we're going to dive into the meat and potatoes of our time today, deliverables 1 and 2, which is really all focused on supporting you to illustrate the impact on the opioid crisis that your proposed project would have through the use of what we like to refer to as a key driver tool. Now, what is a key driver tool? I like to think about how in the nonprofit, the social sector, a lot of folks are familiar with the concept of logic models. Now, a key driver is very similar to a logic model, but unlike logic models, really starts with the end in mind. And so it goes from left to right, starting with what is that big problem or challenge you're trying to address, all the way to funneling down to what are you doing about it and how are you tracking progress. Whereas many logic models start with those activities and then ladder up to what the bigger impacts and outcomes are. A key driver is just one of many potential tools out there, but the one that we tend to use a lot at the Rocky Mountain Partnership that helps us make informed decisions, develop effective strategies, and monitor progress towards improving a specific problem or challenge. I like to think of this tool as not just a tool, but it's actually part of a larger approach on how we approach and think about identifying, understanding, and validating the things that are contributing to why a problem or challenge exists, why it is the way it is, and we call these factors, barriers, or root causes. What's helpful about this tool is that it's not only used to help understand what factors exist, but also to what extent of an influence they have on the problem challenge. This can help individuals and organizations like you best focus your efforts and resources on what is going to have the greatest impact on the problem or challenge you seek to address, and in this case, related to opioid abatement. Keep in mind that factors can be identified, assessed, and validated in a variety of ways using local, regional, state, and national data and research, and of course, most importantly, from those directly experiencing the problem or challenge. So All this to say, as you think about the key driver tool, keep that in mind of who might need to be at the table to help you build this. We very much encourage you to think about the stakeholders you need to support the development here and not attempt to do this all by yourself or alone in a silo. What you are looking at on the screen now is our key driver template. As I mentioned before, probably looks pretty similar to a logic model, but we do start with the problem, move into the current state, factors, strategies, interventions, and then key performance indicators. I promise we will dive into each of these, so no need to try and figure out what goes where at this juncture. We will walk you through step by step. In addition, I did want to talk a little bit about the bigger picture of the opioid crisis in Adams County. In addition to each applicant for this round, as well as grantees from the cycle one of the grant, developing a key driver, the Rocky Mountain Partnership team has developed one on behalf of the Adams County Opioid Abatement Council that outlines the larger opioid crisis in Adams County. It includes those same elements, right? The data that tells us about what's currently happening around the opioid crisis, the factors and barriers that are contributing to the opioid crisis, evidence-based strategies that could be impactful in this region, efforts underway that are being supported by the Adams County Opioid Abatement Grant, and of course, we love data, metrics that are being tracked in real time to show progress and impact. This not only helps set up our region for success, in distributing the litigation settlement dollars, but it also helps us identify where additional needs and gaps are. Ideally, each applicant and funded grantee key driver will ultimately ladder up to this bigger picture key driver. So just thinking about the bigger picture here, keep that in mind as you start to craft your key driver as well. Now let's dive in. What are those elements of a key driver? I mentioned these a little bit before, but a key driver tool primarily has 5 different elements. First is the outcome you are trying to accomplish or the problem you're trying to solve, or both, and highly recommend both pieces of that. The current state, factors and barriers, strategies and interventions, and key performance indicators. I want to just emphasize and say out loud that a key driver tool is intended to drive strategy. And unlike a lot of logic models that tend to get put on a shelf after they've been developed and never looked at again, they're in some dark closet somewhere at a nonprofit building. This should be a live document that improves as you continue to get and validate information. And it should also help inform you to make adjustments to your strategies in real time based on what the data and information you're gathering are saying. Now we're going to take this piece by piece, and feel free to stop and pause this video at any time. I also do have some prompts to help you with that and identify those stopping points if you want to work on one piece at a time. Otherwise, you could just keep rolling and move through the full key driver. Please note that I'll say this a couple of times throughout this video, but we do have the ability for you to access additional resources on the Rocky Mountain Partnership website that I showed you before. And I'll just do a quick tour of where those live now. When you visit the Rocky Mountain Partnership, again, rmpartnership.org, you can actually hover over the work, go to Addressing the Opioid Crisis, and click on the Opioid Abatement Grant. Now you're going to find a letter from the Adams County Opioid Abatement Council just about the spirit of the grant, what they're looking for. In addition, you'll find some resources available online. The first is the application. There's an application guide that has more information about the application process, supporting documentation, including the key driver document. And there are a couple of different applications depending on if you receive Cycle 1 funding or if you're a new applicant. In addition, you can preview the scoring matrix that is used by the Opioid Abatement Council to score applications. You will see a recording of this workshop live up here just after this is done being recorded and uploaded. We are also offering optional 60-minute coaching sessions to grant applicants to provide support around your application and key driver tool. And then the other thing that will be live as this report is being updated is actually an interactive toolkit that walks through these slides, has links to different templates and additional resources above and beyond what we'll cover in the workshop today. There's also a timeline, an FAQ document, a ton of great information for you. All right. Now that we got that out of the way, I'm going to go ahead and dive into our first couple columns in the key driver. These are all focused on identifying the problem you are working to address and the data that tells you about it. What problem or challenge are you trying to solve or improve? When you think about those first two columns, you really want to focus in on what's the specific issue, challenge, or opportunity that you are working to address in your work. It should encompass both the problem you are trying to solve and the desired outcome you seek to accomplish, because that shows like, where are you now and where do you want to be, right? It reflects that gap between the current state and what success would look like. What's helpful about identifying and defining this problem outcome is that it provides a clear focus and purpose for your work and those potential strategies and interventions that can come. I have a couple of examples for you just so that you can kind of get an idea of what this looks like in the tool. For example, the opioid epidemic is debilitating our community and economy, and we do not have enough capacity to address it. Towards this, we are working to provide treatment to an additional 100 Adams County community members who otherwise would not be able to access it, which will support more folks to survive. Another example, the opioid epidemic is debilitating our community and economy, and we do not have ample prevention programming that supports youth to understand its effects. Towards this, we are working to provide prevention and education programming to 1,000 youth in the ABC school district, which will aim to prevent additional youth opioid overdoses. Now, I want to just offer the disclaimer here. These are examples. They don't have to exactly look like this, and they are also fictional. I made these up. These are not problem statements or challenges from real organizations, because many of the work that you all are doing as organizations looks different. And so we want to make sure that you're able to craft it in a way that is really shows the unique role that you play in this fight and opioid abatement work. Very complementary and related and has to go hand in hand with this problem and challenge is our current state. What is the data that tells us around what's happening with that problem? The current state represents the existing conditions, performances, or situation related to the problem. It can be based off current data, metrics, observations, and of course, voice and perspective from those who are experiencing the problem or challenge. If you understand the current state, you're able to develop a data baseline for setting goals on towards addressing your problem, and it will also help point to where action is most needed. When we talk about goal setting, you may have heard the acronym SMART. We are a big believer in setting SMART goals. These are goals that are specific, they're measurable, they're attainable/achievable, whatever verbiage you want to use there. They're relevant, and of course, they are time-bound. This helps you make sure that you have a clear picture of where you're trying to go, and you can actually adequately measure progress towards that. So building off those examples from the last slide, here are some examples of a current state and goals. Example 1, current state. Over 450 Adams County community members have died from opioid-related overdoses over the last 3 years. Goal, provide treatment services to an additional 100 Adams County community members over the next year, which will support more individuals to survive. Going back to the other example, here's an example of current state and a goal. 460 Adams County youth ages 15 to 24 were seen in emergency departments and admitted to hospitals for opioid-related overdoses over the last 6 years. And this fictional organization's goal is to provide prevention education programming to 1,000 youth in ABC school district over the next 2 years, which will aim to prevent additional opioid overdoses amongst youth. Now, a couple things I want to say out loud here. The Rocky Mountain Partnership does a pretty robust job of tracking community level metrics. So the expectation is not that you are going to try and tackle an incredible amount of like reducing opioid deaths by 20% in Adams County. That is a goal that not one organization or entity can tackle alone. That's why it's so important to work collectively. What you should be really thinking about in your current state is, yes, what are those bigger community level outcomes? You can check out our opioid data hub to see what those could potentially be for your space. That's something we already track. The expectation is not that you're tracking that, but it is good to know so you have a starting point. When you're thinking about setting a goal, it really needs to be something that's within your sphere of influence. So of that larger problem and what's happening, what is that bite of the problem that you and your organization or your project can take on? So you see some examples of just treatment to 100 more community members or prevention and education to 1,000 youth. So as you think about your current state, your problem and your goal, what is that piece that you can really focus on as an entity or collective? Now this, I'm going to give you some instruction here, but this would be a great juncture to pause the video and work on your problem outcome and goal if you'd like to do it piece by piece along the way. At this point, what will really help you is looking towards those two columns, and the blank key driver template is on our website. So if you don't have it, now would be a great time to pause and go grab it. If you're looking at your problem, outcome, and goal, that is the first two columns. What you'll want to make sure is answered in those two columns, and you can use as many spaces as you want. Some people use all 5 things because they've got 5 different current state metrics they're looking at, and some only have like 2. So we just built it that way so that you have ample room. You do not have to have 5 of everything, or however many boxes there are in there. All right, so when you're thinking about filling out those first 2 columns of your key driver, first you'll want to identify what is the problem you will work to address through your problem. And you'll want to put that all the way on the left-hand side in the first column. Secondly, you'll want to think of what data is available that helps you understand this problem. You for sure want to put those metrics in column number 2 under current state, but you could also allude to some of that data if you'd like to help give a more robust picture of the problem in column 1. This is where I say they work hand in hand together, which is why we don't talk about these separately. Third, what within your sphere of influence will you work to do towards this problem? This is when you'll start to want to add a little bit more of that narrative to your column 1. And then fourth, set a high-level SMART goal. This is where you're going to think about, is it serving 100 more community members? Is it doing prevention for 1,000 more youth? What does that piece of the pie look like for you? Again, I'll make a nod that you do have those resources available on RMP's website to help you. The recording of this content, which you're obviously watching right now, the Opioid Abatement Grant Key Driver, and our Interactive Data Toolkit, the Opioid Data Hub, and then also sign up for coaching if you'd like. All right. So at this juncture, you've either paused and started working on it, or you're just like, I'm going to learn, soak it all up, and then take a stab at it. Either way works. That's whatever works for you is how we want to support you to move forward in order to be able to apply for this grant. All right, we're going to move on to column number 3. This is all about identifying the factors and barriers that you would work to address through your project. What are factors and barriers? Well, these are the things that are contributing to why the current state is the way it is, why people are dying from opioid overdoses, why we don't have capacity, whatever the problem is that you're thinking about addressing. These are the elements or conditionings that are contributing to why the current state is the way it is and what is standing in the way of solving your problem or challenge. Identifying and understanding these factors really helps you narrow in on what are going to be the most effective strategies and interventions to have the most impact towards the problem. I do want to clarify that these are not necessarily challenges that you, yourself, or your organization are experiencing around your programming. These are a little bit more community-wide things that are happening. Things like there's not enough treatment beds, inpatient treatment beds. There's not enough access to MAT treatment. There's not enough workforce around behavioral health, things like that. And some of those might be things that your organization also experiences, but these are really designed to be things that are happening a little bit more community-wide because, as I mentioned before, this is kind of like a funnel. In a logic model, you kind of go up, right, and get bigger picture. With a key driver, you start to narrow in based on the big picture. And so you're starting to narrow in here. If you've got this big problem, you've got the current state, you've got the things that are contributing to it, and then we'll get there. But the next step is like, what are you going to do about it? So some examples of factors or barriers. There's a major gap in capacity for treatment and recovery in the Adams County area. There's a gap in evidence-based primary prevention work in Adams County school districts. These are just some examples. Other things could be like, well, folks don't have transportation to access treatment, or treatment is not culturally relevant, or there's not enough harm reduction happening across the Adams County area. Whatever it is, those are some examples. Again, they're building off the last examples as well. I am going to show a quick video, and I'm going to pull it up on YouTube because the last time that I did this, for some reason, it did not play correctly. This video is an example of identifying factors and barriers in a real life problem. It's focused on the Jefferson Memorial and a problem that they were trying to solve around that. It's kind of a funny example, but I do think it does a good job illustrating kind of the thought process and approach to really understanding what are those things contributing to the current state. I like to think about this example as like, if you've ever worked with a toddler or a little kid, or you have one in your life, they're always asking the question, why? Why is this? Why is that? Why is this happening? Well, why is that the case? I have a 6-year-old niece and she asks me that all the time of like, or her mom, I get Snapchats from my mom of her asking, well, why is this existential life thing? So this is all about that. Here's a real life example. I'm going to stop talking for a bit and we can watch this video together and then we'll keep rocking and rolling. Like I said, this is kind of a funny example. Like I mentioned, this is kind of a funny example. But the reality is there are things like airports that get moved all the time. Like I mentioned, this is kind of a funny example. And the reality is, this is how decision making happens a lot of the time, is that people are moving airports and identifying these crazy expensive solutions just kind of based on a little bit of evidence, but they don't quite have the full picture. That's why it's so important to understand factors and barriers. I'll also say out loud, the reality is, y'all who are listening on this call, not necessarily probably moving any airports. And the reality is the opioid crisis is not going to be fixed by turning off the lights an hour earlier. However, what this does help illustrate is the importance of thinking about who you have in the room to help identify what these are, and really clearly identifying these and asking why enough times to really uncover what are those root causes that are contributing to that. When you address root causes, you have more effective solutions because you're not just addressing these symptoms, you're actually getting at the root of it to help eliminate it in the future. Now, this again is a great stopping point if you'd like to pause the video and have some work time on identifying your factors and barriers for the third column of the key driver tool. Otherwise, you can keep rolling. Really, when you're thinking about the third column, you'll want to think about two things. What are those factors and barriers that your project will aim to address? And then also, how do you know that these factors, barriers are contributing to the opioid crisis in the region? Have you looked at data? Have you looked at research? Have you heard from the community members who are directly impacted by the opioid crisis? Where are those sources? How are you validating that those are contributing to the opioid crisis? Again, you have resources available to you on the RMP's website to help you. This video, obviously, this is how you found it. The Opioid Abatement Grant Key Driver and Data Toolkit, the Opioid Data Hub, and of course, coaching slots as you'd like. Now, assuming you're ready to keep rocking and rolling, I'm going to move us into the next section of the key driver. Now we're on to step 3 in the fourth column. I know, a little bit confusing, but step 3, this is the spot of the process that I think most entities are comfortable with, because we, especially in the social sector, are really good at doing this. This is all about identifying the strategies and interventions we would pursue through the grant. So what can be done to address these factors and barriers? These are the planned actions, approaches, or initiatives designed to address the problem and to overcome specific identified barriers. So the idea behind this, not you're just like, oh, I think this might work, but really thinking about, okay, if we're trying to address XYZ barrier, transportation or capacity or whatever it is, that you've got some kind of strategy that is linked to that, or linked to multiple factor barriers. Those factors and barriers represent these strategies and interventions, I should say, they represent what you are doing to change and improve the current state. They should outline the specific steps, methods, and resources required to achieve the desired outcomes. Now, your strategy and interventions can have multiple components, and you can list those individually because they might identify different pieces of the problem. Something I also want to say out loud is don't feel like you have to eat the whole elephant or boil the ocean or whatever phrase you want to put in there, right? Think about where your unique role is in the opioid abatement work and go big in that space so that you can maximize impact. I know that there are a lot of spaces that folks can operate in the opioid abatement work, including treatment and recovery, harm reduction, prevention, education, rural abatement, like all the things. Where are you and your services really needed and good at, and go hard with that and focus in that area rather than trying to hit every single area because there's money available in every area. If you do what you know you're good at, that's going to have more of an impact in the long run. All right, so building on those examples from earlier, we got some examples of some strategies and interventions here. Number 1, provide MAT or Medicaid-assisted treatment to Adams County adults through a community-based clinic. Another example, administer the Positive Youth Development Program to middle and high school classes in ABC school district. You would have other things here too. You might have multiple components. You might just have one strategy, which might be to hire a person to do something. Who knows? I don't know what you're applying for, but these are some examples of strategies and interventions. Again, in true fashion, this is a great time to pause the video and work on identifying your strategies and interventions. If you are, I forgot to say this earlier, but if you are doing this by yourself, make sure you're working with the other folks who would be implementing the work as well. I think it's really important to have them as part of the conversation. Often folks who come to these workshops are like the grant writers or the person who's filling out the application, but maybe not the implementers. They can provide a lot of perspective on what this code should look like. So just keep that in mind. All right, so if you're planning on working on it now or later, whenever you're focused on it, here's what you're going to want to be thinking about for that strategies and interventions column. What are those strategies or interventions or components of those things that you're thinking about deploying through your project? And are any of these strategies or interventions evidence-based, meaning that they've been externally evaluated for efficacy? A great resource that's available if you're curious about whether or not what you're doing is evidence-based. Johns Hopkins has a primer on opioid litigation spending that talks about different evidence-based solutions. And then there's, of course, a lot of resources in the Opioid Data Hub, as well as the other resources that I've continued to reference: coaching, the Key Driver and Data Toolkit, and of course, this video. All right, now that you've got strategies and interventions down, we're going to move into the last part of the Key Driver. Last but certainly not least, this is all about identifying how you are going to track and measure progress in real time, aka key performance indicator column. These are what can you measure. It could be quantitative or qualitative. It doesn't just have to be hard data, right? What can be measured to track progress and impact on the problem or challenge? These are measurable metrics that help that tracking and evaluating progress towards the outcome. I like to think about key performance indicators as spun into a couple of different buckets. First is, I think, what most folks are familiar with. Anytime you have to write a grant, everybody's always asking about your quantity and your quality, right? How much did you do it? How well did you do it? How many backpacks did you distribute? How many vaccines did you give out? How many people did you serve? Were those folks happy when they came to a prevention education training? Whatever that looks like, right? I always really want to emphasize and push on this other bucket. And these are more of your impact measures. These are things that allude a little bit more towards your direct impact or the piece of the impact you're having on the problem and challenge. These are really thinking about what difference did you make and how are people better off. Ultimately, these key performance indicators in both buckets here, the quantity, quality, and the impact, are really focused on helping you assess the impact and success of your implemented strategies and, of course, their impact on the larger outcome you're trying to achieve. Some examples: number of Adams County community members receiving MAT, number of MAT recipients who indicate improvements in their well-being. Some other examples: number of youth who receive the positive youth development curriculum, number of youth who indicate they feel more adequately prepared to handle their daily lives without drug use, right? Like, this is where you can get creative because not all of your data has to be numbers. This is where stories and accounts and testimonials and some of the more qualitative data that can come from things like surveys or focus groups or interviews can also be useful and help you really have a holistic picture of your progress and impact. Again, and as I've mentioned a couple times before, this is a great time to pause the video and do some work time, or if you want to keep rolling, we're almost done, and then you don't have to hear me talk anymore. At this juncture in this last column for key performance indicators, you're going to really want to think about what is that data, both quantitative and qualitative, that you could track to help measure the progress and impact of your strategies and interventions. This is also where I would encourage you to develop a measurable goal for each, because that's really going to help hold you accountable to impact. What that also does is when you establish a goal and you're actively tracking progress towards it, it tells you whether or not you might need to adjust your strategy or intervention to help you achieve the goal. This should be real-time data, not just an afterthought evaluation after the fact. Again, a ton of resources available to you on RMP's website that I have continued to mention throughout. You've made it. We're at the end of the workshop. So let's talk about next steps. So submit your application, including your key driver, by November 3rd. That is the deadline, so don't miss it. Also, I've said this a million times, but there are so many resources available to you on RMP's website. We've got the Opioid Abatement Grant Key Driver and Data Toolkit. You're welcome to watch this video over and over if it's helpful at all. The Opioid Data Hub, coaching with the RMP team. Again, optional 60-minute coaching sessions with myself and one of our other team members to make sure that you're equipped to apply. Downloadable application, FAQs, all the things you can imagine, as well as the email for Jody Nowicki, our Senior Director of Stakeholder Engagement, who project manages this work. Well, we have officially wrapped up. You are well equipped with some knowledge to help you begin building your key driver for the Adams County Opioid Abatement Grant Cycle 2 funding. If you have any questions or need additional information, feel free to visit our website, which is on the screen. And you can also contact Jody from our team directly. Her email is on the website. Cheers.